This is Health Matters, another podcast from Ridgecrest Regional Hospital, bringing world-class healthcare close to home because health matters.
How do you know when your child has the flu or just a really bad cold? During flu season, it's understandable for parents to worry about their children contracting the flu, but it's not always easy to know what symptoms they should be looking for. I'm Prakash Chandran, and in this episode of Ridgecrest Regional Hospital Health Matters podcast, we'll be talking about recognizing flu symptoms in children and what you can do to help your children stay protected. Here to help is Dr. Andrew Modic, a board-certified physician in both internal medicine and pediatrics at Ridgecrest Regional Hospital. Pleasure to have you here, Dr. Modic. Now, when children start exhibiting symptoms like sneezing, fatigue, or they come down with a fever, I think every parent wonders what's going on and how serious is it. So the first question really is, how do you separate flu symptoms from those of a really bad cold?
It's difficult. The flu virus is caused by the influenza virus. So in general, those symptoms tend to be a little bit worse than the viruses that cause, say, the common cold. But when you think about the flu, about 95% of kids will have a fever. Many of those over 102 degrees Fahrenheit. So generally, if the kid doesn't have the fever, it's probably not the flu. But the other symptoms, the cold, the runny nose, headache, muscle aches, and even younger kids, sometimes they can have nausea, vomiting, and tummy pain. And typically these symptoms tend to have an abrupt onset. So classically, a parent will tell me, my child was perfectly fine in the morning and felt great, and then by the afternoon they just look and feel miserable. And these symptoms can last anywhere from usually less than a week, but some kids can have cough or even fatigue for up to 2 weeks.
So what I'm hearing you say is that if your child has a fever and these symptoms come on very quickly, then it's probably the flu. Is that correct?
It's difficult to tell. It is difficult, and there's no great perfect criteria. But fortunately, we also do have the flu test, which we have the rapid flu test, which is used in most pediatric practices, and generally it's a good test if it says you have the flu. So if it says this is a positive test, you have the flu, then you can be about 99% sure that you have it. But unfortunately, if the test is negative, then it only detects the flu in about 50 to 70% of cases. So in these cases, your physician may look at your child's symptoms, exposures to the flu, what is the rate of the flu in the community, and still may decide that this is the flu, or may decide to treat for the flu if their suspicion is high enough.
Okay, that makes sense. I didn't know that there was that test. So it seems like if you're suspecting that your child has the flu, the best thing to do is go ahead and bring them in to do this test just to make sure and to be on the safe side. So my question is, if you find out that your child does have the flu, what should you do? Is it just rest? Is there antibiotics or medicine that you should take? Talk a little bit about that.
Yes, we do have an antiviral treatment for that, and the most common one that is used is called Tamiflu, also called oseltamivir, and it's a 5-day course. And just like you were saying, the earlier that that your child is treated for the flu, the better that they'll be. For example, if you start Tamiflu within the first 12 to 24 hours after your child starts showing signs of being sick, then it can shorten the illness by up to 3 days in some cases. If it started around 48 hours after the onset of your child being sick, it can shorten it by about a day or so. But even this, if you've had the flu, even this can be significant. Also it can shorten the complications and decrease the rate of complications from the flu, like ear infections and pneumonia. And in general, there's been minimal resistance, at least among last year, for the Tamiflu in terms of treating the flu virus. So if you think you think your kid has the flu, get them in early. And if within 48 hours, it's probably a good time to start treating for the flu with the Tamiflu. And even in some cases, for kids that are, say, high risk for problems, with flu complications. Let's say they are less than 5 years old, or they have asthma or heart conditions or some other chronic illness. Your pediatrician may decide to treat even after they've had symptoms for 48 hours. And in general, I get this question a lot. In general, the side effects from Tamiflu is generally very well tolerated. About 14% of patients will have some nausea or some tummy pain from it, but certainly this is much better than having the flu.
It certainly is. So you mentioned a couple times the importance of trying to bring your child in early if you start recognizing those symptoms. So I want to focus a little bit more on those symptoms specifically. You mentioned nausea, you mentioned some weakness, and it happening quickly. But what other things should parents be looking out for to really tell them, hey, you know what, this is a problem. I should bring my child into the doctor?
Yeah, it's tough and it's difficult for parents. But if you think about it, if it's fever and again, 95% of kids with the flu will have a fever. So if it's not fever, if the kid doesn't have the fever, it's probably not the flu. But cough, runny nose, headache, muscle aches, and think about an abrupt onset, and in general, think about the fever. But again, it's tough even for pediatricians to tell sometimes. And we do have the rapid flu test, which helps. But sometimes you just kind of have to know what, is this a high time for flu? Is this community affected by the flu? And that's difficult for parents to do. So any questions, any concerns, please see the pediatrician.
Yeah, that's really good advice. And I think the thing that I picked up on right there is just knowing, when you're in flu season, especially, you can never be too cautious. It's always better to just, bring your child in and get tested. So I want to shift a little bit to preventative measures. Let's talk about the best ways that a parent that is concerned can keep their child protected, especially during flu season.
Absolutely. Well, the best way to prevent the flu is to get the flu shot. That is the best way. There are other things you can do too. The flu is spread via contact with contaminated oral secretions, so sneezing, coughing, talking, or touching. And generally, you need to be within about 6 feet of someone who has the flu in order to get it. But the caveat being, if that person sneezes on their hand, they touch a contaminated surface, and then you touch that surface, or your child touches that surface, and then they touch their mouth, their eyes, or their nose, certainly the flu can be spread that way. So wash your hands. Avoid touching your eyes, your nose, or your mouth. If you can clean surfaces, if you come in contact with someone who might be sick, clean surfaces with disinfectants. And finally, in some cases, and this is decided on a case-by-case basis, there are some kids who will benefit from taking Tamiflu prophylactically, which means either they take it before or after an exposure to the flu. And generally, these kids tend to be at high risk for complications of the flu. For example, they might be less than 5 years old, they might have severe asthma, and there might be an outbreak in the community. And this is something to discuss with your pediatrician.
So, it's interesting with everything that we've heard, and, so many people say that the best thing that you can do is to get the flu shot. It still seems like there are parents that are hesitant to get it. So can you speak to, why that is, and maybe some of the hesitations that parents might be feeling in doing so?
Absolutely. And I talk to parents a lot about this subject. And when it's brought up, I first remind them that we're on the same team. We both want to keep their child healthy and happy. The most common reasons I hear is really two main ones, which is one is I don't want them to get sick, and two is I don't want them to get the flu. And so first, you cannot get the flu from the flu vaccine. The flu vaccine is a dead flu virus, and so it can't give you the flu. So just like a dead crocodile isn't going to bite you, a dead flu vaccine isn't going to give you the flu. And second, if the flu vaccine, if it does have a problem with it, it's that the immunity only lasts about 6 months. So most kids will get between 3 and 8 colds per year, but they're not spread out evenly throughout the year. Most of them occur between November and March, and that's also flu season. So we give the flu vaccine before the start of flu season. And so I understand when these parents tell me that their kid has been healthy during the entire summer, during half of the fall. All of a sudden they get the flu vaccine and then they get sick. But in those cases, I just try and counsel them that the flu vaccine is not the cause of their illness. Rather, it's one of the things that they can do to protect their child. And in terms of the side effects from the flu vaccine, very rare. Some people will have side effects, most common being soreness or redness at the injection site, low-grade fever, headache, muscle aches. But usually these are very mild, usually last 1 day, sometimes 2. And what's more important, they don't carry the complications of the flu that in some cases can be life-threatening.
Love that metaphor you gave there about the crocodile. A dead crocodile can't bite you, just like the flu shot cannot give you the flu. Well, that's really good to know. The last question that I had is, I'm actually, my wife and I are expecting, and I was curious as to what is the earliest age parents should consider taking children to get the flu shot? Is it, too young for a newborn? Is it 1 year old? Maybe talk a little bit about the right age to start doing that.
Absolutely. First off, congratulations to both of you.
Thank you.
And so kids who are 6 months old and older can get the flu shot. And just of note, if it's your child's first time getting the flu shot and they're less than 9 years old, then actually they have better immunity if they get 2 flu shots that flu season and separated by about a month. But to also answer your question, kids who are less than 6 months old, they're not given the flu shot, but certainly they can still get the flu. And in fact, they have a higher rate of complications from the flu once they do get it. But unfortunately, giving the flu vaccine to them is not going to help them because they have immature immune systems. And therefore, if after the flu vaccine, they don't develop the antibodies that can protect them against the flu. So there's no point in giving it to them. But instead, these kids rely on what's called herd immunity, which means that everyone around them should get the flu shot, and that's the best way to protect them. So another reason to get the flu shot, even if you don't believe that the benefits to you are significant.
Yeah, if you're not doing it for yourself, you're definitely doing it for the people around you. Well, Dr. Modic, I just want to thank you so much for taking the time today to share all these tips. I'm assuming that all parents listening feel much better about things, and it's just really important for those listening to go out and get your flu shot. So, for more information, please visit rrh.org. My guest today has been Dr. Andrew Modic. I'm Prakash Chandran. Thank you so much for listening.